My main office, again, is in Kearney, but I also have outreach clinics in Gothenburg, McCook, Aurora, and Osceola. I joined the group back in 2003 after spending 9 years as an Air Force urologist stationed at Offutt Air Base here in Bellevue, Nebraska. I'm originally from Buffalo, New York, and I'm a big Buffalo Bills fan. For our webinar today, I will focus on overactive bladder or OAB and treatment options. Many of you might feel like the patient quoted here, concerned, exhausted, or overwhelmed, but too embarrassed to talk about it. Embarrassment is the real issue of concern for as many as 44% of people with bladder control issues. Too often, it prevents people from getting the help they need. We are here to change that. Attending this kind of event is a step in the right direction. So thank you for your courage. I hope you will continue to speak up about this important issue. Again, welcome and thank you for joining us. Here's what we've been talking about tonight. Understanding bladder control is an overview of how the bladder works and some of the problems that occur. The care pathway shows a possible progression of treatment. Treatment options offer more detail about the many ways to treat bladder control issues. Medtronic bladder control therapy covers 2 proven and effective options. And then we'll wrap up the session with questions and answers. You need to know you are not alone. 1 in 6 adults has OAB. For example, it's more prevalent than vision problems or diabetes, 2 conditions most people think is extremely common. You may ask yourself, if it's so common, why haven't I heard about it until now? Many people with OAB self-manage by drinking less, wearing pads, or restricting their social activities. At the same time, many physicians don't realize how embarrassing it is to talk about this issue. So we don't ask, and you never bring it up, so it stays hidden. Like vision problems, bladder control issues can happen to women and men of any age. And although your risk increases as you get older, that doesn't mean it's a normal part of aging. It's not something you should accept or ignore or leave untreated, because that can raise serious risks for your self-esteem, confidence, and general health. What's normal? It's really important to know that incontinence is not a normal part of aging or something you just have to live with. It is a serious health issue. I'm sure these descriptions will sound very familiar to many of you. Bottom line, OAB can be a very embarrassing condition, and it can have a significant impact on your quality of life. It may prevent you from going places or doing things that you like, fearful of an accident, always looking for the next bathroom, or making frequent trips to the restroom throughout the day. If that's the case, you need to listen to your body. How does bladder control work? To understand what your body is saying, it is important to know that communication is critical to how the bladder works. Bladder function involves the coordination of the brain and muscles through our nerve signals. As your bladder fills with urine, nerves tell your brain that it needs to be empty. Research suggests that bladder control problems are linked to poor bladder-brain communication. Keep these points in mind for later when we talk about various treatment options. What causes bladder control problems? Where do communication problems come from? There are many potential causes. Some are as simple as what we eat, drink every day, or the medicine we take. Some are related to life events like childbirth or health conditions. You may also have injured your pelvic floor. There are three common bladder control issues: stress incontinence, urinary retention, and overactive bladder. We'll take a closer look at each one of these. What is stress incontinence? Stress incontinence relates more to physical activities. It occurs when there's an increased pressure on the bladder as a result of cough or sneeze or physical activities such as lifting, running, resulting in a sudden loss of urine. Stress incontinence is typically due to weakened or damaged floor muscles. This type of incontinence typically requires surgery to correct. What is urinary retention? Urinary retention happens when you can't tell if your bladder is full. This can be incredibly frustrating. It may also require you to use a catheter. It may or may not be caused by physical obstruction, such as enlarged prostate in older men. You may have obstructive or non-obstructive retention. OAB is defined by the following symptoms. Urge incontinence is the sudden urge to go to the bathroom, which also results in actual loss of urine because you can't make it there in time. Frequency means frequent trips to the bathroom, as well as constant urge to urinate that often leads to leakage. If you have OAB, you may have a variety of these overlapping symptoms. It's our job to work through these symptoms to help you find a therapy that fits your needs. The good news is OAB is treatable. There are a number of steps involved in finding the best treatment option for you. Conservative treatments, such as those seen on the left, or advanced therapies. We'll take a look at each one. Remember, every person is unique, and what works for someone may not work for another. The first thing to try is often simple lifestyle changes. In other words, these are behaviors that you can use to help improve your situation. It might mean changing what you eat or drink, such as decreasing caffeine intake or getting more exercise. It might involve bladder retraining, such as delaying going to the bathroom or time voiding. Pelvic floor strengthening is also very important, and this can be done by repeatedly contracting and relaxing the bladder muscle, correction, the pelvic floor muscles, also known as Kegel exercises. These are things that you are probably already doing. In some cases, lifestyle changes may not be enough. When lifestyle changes fail to deliver the results you want, oral medications are the next step. These medications work on the bladder muscle, but not the nerves. They can help control symptoms, but they do have some drawbacks. One, you have to remember to take them daily. They do have some unpleasant side effects, particularly dry mouth and blurry vision. Another issue is the cost. These medications can be very expensive, even with insurance, and they don't always work. In one survey, 72% of patients said they stopped their medication after 6 months. One last point. For some patients, OAB medication causes some confusion or memory loss. In fact, a recent large study funded by the National Institute of Aging and published in the Journal of American Medical Association has shown that elderly patients taking anticholinergic medications are at greater risk for developing dementia. Advanced therapies. If conservative therapies don't work, then we moved on to more advanced treatment options. Medtronic offers two of these therapies. And the third option is injection medications. I'll discuss the trade-offs involved with each one of these options. Injection medications, particularly Botox, treat overactive bladder temporarily and require multiple ongoing office visits. Each injection typically lasts approximately 6 months. Just like oral medications, injected medications focus on the bladder muscle and not the nerves. The medicine is injected directly into the bladder muscle to paralyze it, which is why this treatment does not address the bladder-brain communication pathway that we discussed earlier. If you use injections, you may be more susceptible to urinary tract infections and end up having to catheterize yourself temporarily while you wait for the medication to wear off. These injections are typically no more effective than oral medication, which may be why 51% of patients quit after just 2 treatments. PTNM, or percutaneous tibial neuromodulation, is proven to restore bladder function. This means it reduces urgency, frequency, and urinary incontinence, which can improve your quality of life and the possibility of lasting relief. The most common side effects are temporary and include mild pain or skin inflammation at or near the stimulation site. Here's how the therapy works. It stimulates the tibial nerve, which is located just above your ankle. The goal is to restore bladder function, achieving a measurable reduction in your OAB symptoms. Each treatment session lasts approximately 30 minutes and it can be performed in the office. You start with 12 weekly sessions and then move on to monthly maintenance sessions. Next therapy, the interstem system or sacral nerve neuromodulation, SNM, provides relief and restores bladder function by gently stimulating the sacral nerves. This corrects the bladder-brain communication pathway and restores bladder function. Medtronic has recently introduced MRI-compatible rechargeable free and rechargeable devices. I would say the interstem system is the most popular treatment option for my patients. %84 of patients are satisfied with it. You have 3 times greater improvement in your quality of life compared to medications. 76% of patients achieve success compared to just 49% with medication. This is the only therapy that provides better relief than medications. So is this therapy right for you? So what makes someone a good candidate for it? If you have significant OAB symptoms like urgent incontinence, urgency, frequency, or if you have non-obstructive variety of urinary retention, or if you've already tried many different kinds of lifestyle changes and oral medications. And most important, if you're not getting the kind of relief that you want or need to get back to living the life that you want. If this sounds like your experience, then the first step is typically an evaluation. You can call my office at Carnegie Urology at 308-237-7719, and we can set up an appointment to discuss your problem and possible solutions. Here's more information that you can get on the website, on the web. Thank you. I appreciate your time and attention. And again, thank you for joining us. We'll now have questions and answers.
Thanks, Dr. Williams. Great job kind of running over overactive bladder and some of the potential options and treatments. I do have to say I'm sorry that about your bills last Sunday.
We'll get them next year.
There's always next year. They represented themselves well.
Well, thank you.
But to those attendees or participants, please go ahead at this point, and if you do have a question, please type it into the Q&A or the chat, and we will address it and go from there. We'll give you a couple seconds or minutes to do so here. Thank you. Okay, Dr. Williams, here's a couple that have come through. The first one says, will these treatments cure my condition? I don't know specifically which one they were mentioning, but just that's a question.
Well, they don't specifically cure the condition. They're treating your symptoms. In other words, you're treating the urgency, the frequency, but you're not per se curing it.
Okay, thank you. Another question, what does the stimulation with the interstem system feel like?
Most patients will describe sort of like a tingling sensation. You may feel that in your pelvic area or going down your legs, but for the most part, particularly when the settings aren't too high, most patients don't feel much at all.
Okay. Another question, does insurance typically cover the cost of these different options that you mentioned?
Most insurance do cover it, either Medicare or private. Generally, for private, we get pre-authorization before we proceed with the implant. But obviously, it's going to depend upon your insurance because all insurances are not the same. But I can say most do cover it.
Okay, thank you. There is a very specific question. Somebody mentioned they'd like to set up an appointment with you. And I think the best way to do that is probably just to have them call your office. Is that what you would recommend?
Yes.
Okay. So for the attendee that typed that in, if you want to just call their office in the morning and mention the webinar to the gals in his office, they'll go ahead and get you set up for an appointment with him. Two questions, and these are kind of the same, so I'll read them to you at the same time. It says, how is the interstem placed, and then what is involved in the implant? So I think that's kind of the same type of question.
Sure. We generally do ours in fact, we do all of ours in the OR. We give you a light anesthetic. And basically what happens is They're small needles or probes that we place in your back down towards the sacral nerves, which are in your pelvis. They're all external. You have an external device hooked up to this. And then basically we test for 5 to 7 days where you see if you're getting the improvement that you want. If everything goes smoothly and you like the results, then we bring you back usually about 2 weeks later. And we basically do the same procedure where we put permanent implants underneath the skin with the battery or the device, again, underneath the skin, just almost like a cardiac pacemaker. And this generally lasts between 5 and 7 years, depending upon the setting. And also, they have the rechargeable ones that I think you recharge every week.
Correct. Yeah, the rechargeable option that Medtronic has that's newly approved, we recommend charging it once a week for about 10 to 15 minutes, but that device then will last much longer than the 5 to 7 years that the traditional InterStim battery will last. Another question, and this, you kind of addressed this already, but it just says 5 to 7 days in the hospital, question mark.
No,
So
I'm sorry, it's outpatient. So you will test it for 5, 7 days, going about doing your normal activities. One thing you can't do, you can't take a bath while that's on for obvious reasons. But anything else you can do. And then you come back to the office, we remove the electrodes, and then you say, yes, I'm happy with it, I want to proceed, or no, I didn't like it, and then we try something else.
Yeah, so one of the things that we send you home with during the test is avoiding diary. Some of you may have filled one out at some point prior, but it just helps you kind of gauge and keep track of your urination and your symptoms throughout that 5 to 7 day period. And then we come back and see Dr. Williams and his staff. You bring that with, and that really helps you kind of evaluate how you've done compared to your baseline that would have already been established. And so just some quantitative data that Dr. Williams and his staff can help use and help you to use to evaluate how things went during the test period for you. Next question, Dr. Williams says, I have heard of bladder lift surgery. Is that not an option?
Bladder lift surgery is for stress incontinence. It will not help a lot for overactive bladder. If you have just pure overactive bladder, then that would not be a good treatment option. But if you do have stress incontinence, then certainly that's the preferred treatment.
Okay. I think you kind of answered this one. It just says, is InterStim something that's injected into you? I don't know if you want to further explain Botox and how that works as the injection part of it, or?
Sure. So yeah, basically what they're asking about is Botox therapy. Botox, it's good. I certainly use it. There's certainly those patients who like it, particularly older patients who are kind of afraid of technology with the InterStim, the control device, and that they may opt for a Botox. Basically, what happens is we go in with a scope into the bladder and with a needle inject the Botox directly into your bladder. As I said before, it usually lasts about 6 months, and then you have to repeat the procedure.
Thank you. Looking here. The question that came in that says, can I have an MRI with an InterStim? I think you already addressed that, but I'll let you answer that again.
Yes, the newer models that have recently come out, they are MRI compatible, both rechargeable and non-rechargeable units. So yes, you can have an MRI. The older ones, you couldn't, but these new ones, yes, you can.
Okay, I think we're all caught up. I would encourage you, if you do have any other questions, please type them in. We'll give you another minute or two here to do so. As we're doing that, I would encourage you, like Dr. Williams said, just to connect with their office. Obviously, the easiest way to do that is to call them. However, I would put a plug in that they are on social media. So you guys have a Facebook page and some other social media platforms. Is that correct, Dr. Williams?
Yeah, that is correct.
Okay. And then you can also just Google Carney Urology. We have the pleasure of working with a lot of different clinics and practices, and I would argue that Carney Urology's website is as good as any. There's a lot of good information on there. If you need any further information on this or some other options as well. Another question came in, Dr. Williams. It says, just electrodes for InterStim, no actual piece of something. You just want to explain that, I guess, with the permanent implant, there's the lead and then also the battery. I don't know if you want to just explain the two different.
Yeah. With the testing phase is just two small electrodes that go down to the sacral nerve through your back, and then the device is external. And so, again, that's just for the testing phase, and those are all removed, whether you want to proceed or not. Then, when we do the permanent implant, the electrodes are buried underneath the skin, along with the battery or the device. And as I said before, you can have either the rechargeable or non-rechargeable, which is just basically your preference, and both are MRI compatible.
I'll add on there, and Dr. Williams already mentioned it, so I feel comfortable kind of adding it in here. He did mention there is a controller, excuse me, that the patient goes home with both during the test.
Yeah.
And then it's similar but different controller with the permanent implant if you have a successful test that does allow you to make adjustments to the stimulation, meaning you can turn it up and down, you can turn it on and off, and you can change the part of the nerve that you're stimulating using the controller should you need to. But the controller is really nothing that needs to be with you at all times, just something that you need when you want to make an adjustment if necessary. Another question, so it says, so where exactly is this installed in your body?
It's the sacral nerves are basically in the pelvis. So we're working on your backside, just above the buttocks. The battery is installed there also. If you look at your belt line, generally it's just above below the belt line where the battery is installed laterally. And again, all this is buried underneath the skin, so you don't notice it.
Okay, I think we're all caught up. Dr. Williams, anything else that you'd like to add?
That's it. Again, I appreciate your time and attention.
Yes, thanks again, and thanks to you, Dr. Williams, for taking some time out of your busy schedule in the evening to help educate the folks on the other end of the Zoom here. And then, like I said, I'll just reiterate one more time, please follow up at Carney Urology office, and they'd be happy to make an appointment for Dr. Williams to chat with you any further on specifics or any additional questions you may have. So thanks again. Please enjoy the rest of your evening and take care.
Appreciate it. Good night.